Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in Scottsdale Paradise Valley area since 1992, and that's all I do. I just perform cosmetic or aesthetic plastic surgery. I have a lot of male patients, and consequently, throughout the country, one of the largest or most common procedures that I perform in men is surgery for enlarged breast in men, and that's called gynecomastia. And there are different treatments based upon what the presentations are for gynecomastia, and it's a big deal for men. Usually that happens when they're younger, usually in their preteen or teen years, and that manifests itself as, guys call them bitch tits or female breasts in a guy, whatever. But guys are self-conscious. They feel that they have protruding nipples or breasts in a t-shirt. These guys tend to be a little bit more self-conscious about taking off their shirt, and when they are shirtless, they feel very self-conscious. So I can provide a good treatment depending upon what the presentation is. In people that don't have a lot of extra tissue there are some non-invasive treatments that we can do, and that's something called cool sculpting. And what cool sculpting does is it liquefies it freezes the fat in order for it to be reabsorbed. And I would say that not a lot of younger guys are good candidates for this. In older men or middle-aged men, I think they tend to be a little bit more candidates for non-invasive treatment. The reason being is their tissues tend to be more fatty and less glandular. So I can see a nice predictable result as long as there's not too much skin laxity. Cool sculpting is an option. I'd say the vast majority of patients that come in will need some kind of liposuction, whether it be laser or safe SAFE liposuction. That is something that is done inconspicuously through armpit incisions, where I go ahead and liquefy the fat and then evacuate that with a cannula. That's liposuction. And that will take care of the majority of patients. I usually will like to do something called vaser, as I said before, because that will use ultrasound to help liquefy not only the fatty tissue, but help break up that glandular tissue. And then there's a population that will need more advanced procedures. And the best way to find out if you're a candidate for those procedures, or if that's what you need, is you can examine yourself. If you feel a big lump beneath your nipple-areolar complex, that is something that generally has to be removed surgically, and there's a history that usually backs that up. People that have used steroids, people that have smoked a lot of marijuana, people that have taken H2 blockers, those are things that can cause that gynecomastia. In those patients, I will have to make an incision that is placed inconspicuously around the nipple-areolar complex and actually remove that tissue. And that's not a big deal, and I find that in those patients where I feel that I have to do that and I don't, those patients are unhappy because they will feel that protrusion after surgery if I only do liposuction. So really I talked about 3 different things that can be done. That would be cool sculpting, which is non-invasive, vaser liposuction, or vaser liposuction with skin excision. In rare instances, some guys will have a lot of extra skin that needs to be removed, and that's something that we would just discuss to try to talk about what kind of incisions would be used. Oftentimes I can place that incision around the nipple-areolar complex, so you're left with a scar just around the nipple-areolar complex. In those guys that have a lot of extra skin, I will have to do some excision of skin that would leave some scars. But if guys have a lot of hair there, usually it can be hidden beneath the chest hair. So best way to find out if you're a candidate for any surgical treatment for gynecomastia, come in for a consultation. We'll talk about what options are available for you, and then go from there. Thank you very much.